everybody. It is a great pleasure to have today Dr. Matt DiDuro from Atlanta, right?
Yes, sir.
Yes. And we met at the Shockwave conference for the first time at the ISNSD in Prague.
That's correct.
Yeah.
September 9th and 10th. And
Yes,
what a great time in the Czech Republic, and the food, the people, the doctors. You know, what I love most about it is you have 200 doctors from all over the world, different specialties, you know, cardiologists, trauma surgeons, urologists, neurologists, physical therapists, chiropractors, all there with one goal: to promote the advancement of shockwave therapy. So to me, it's just great to be able to rub shoulders with these wonderful researchers, and and to meet you, it was great.
Yeah, it's just incredible. It's like how like-minded people, you know, get together, and as you said, with all these people with all these unique abilities getting together for a single goal. So tell me a little bit about you. Like, what do you do? What is your background? How long have you been in practice?
I'm you know, originally from central New York, the beautiful Finger Lakes region. I've been a chiropractor 28 years after being injured in a lacrosse game. Been married for 30 years to my love, Sherry DiDuro, and we have 3 wonderful daughters, Isabella, Emma, and Analia. And my story is like a lot of other doctors. I you know, was practicing in central New York, was building my dream practice, seeing 280 to 300 people a week. And then I had a patient fall off the table, and I grabbed him, 350-pound patient. It dislocated my right shoulder, tore ligaments in my wrist. Basically, I was out of work for 3 years, had 2 different surgeries, and retired at age 40, 15 years ago. So I went from who's who type of doc to who's that to who cares.
Wow.
And so we moved back to Atlanta, where my wife is from, and I became a professor at a local university here, Life University. And I ran the functional rehab department. And I had $250,000 worth of equipment. My shoulder surgery was excellent, 95% better. My wrist surgery left me in pain for a decade with a pain level of 5. And it was like water torture. It just hurt every waking hour. And so, I mean, I searched for a decade to try to find relief. And it was about 5 years ago that my brother-in-law introduced me to John Warlick from Shockwave Tissue Regeneration Technologies. And I was working in a diabetic and neuropathy clinic. So we work with chemo, diabetic, and peripheral neuropathy patients. And my brother-in-law was like, I think this device can help your diabetic patients. I'm like, no, what is it? He's like, supersonic sound waves. And I'm like, how is that going to help? Right. And I was skeptic, right? I was my dog's here.
It's okay.
I was a researcher at heart, and I didn't believe it would help. And so I got there, and John Warlick said to me, is there anything on your body that hurts? I'm like, oh yeah, I've had constant pain in this wrist for a decade. He did 1 3-minute treatment, and I was pain-free for 2 days, and it was the first time in a decade. And I was just like, you know how like an ordinary event becomes something extraordinary? I still remember the day. It was April 7th, 2017, 2 days before my birthday. And I walked around for 2 days, and I hadn't been able to play golf. I haven't been able to ride a bike, manipulate with my right hand. And, you know, I did everything that weekend before my birthday. It was like a perfect weekend. I had no pain. And then I got 2 more treatments over the next week, and I was 90% better, bought a device, and didn't have to treat my wrist for 14 more months. And I could have done it every week. So I was sold, and I was like, if this just helped me, and I've been searching for doctor after doctor after doctor, then this could help thousands of other people. And I went to John Warlick, and I said, hey, John, I can help. I put this in every major metropolitan city in America. And he laughed, and he's like, oh, chiropractors will never buy this, he said. And you know, literally, we've sold over 600 devices in the last 4 years.
Wow, that's incredible.
Yeah, it's a good story.
Yeah.
John loved me proving him wrong. That's what he says. I love that you proved me wrong. Because he thought chiropractors would be too cheap. that they wouldn't, wouldn't pay for this. But really, all doctors, right? They want results. They want predictable
Yes.
patient outcomes. And I think that's
Yes.
what's so beautiful about shockwave therapy. And I know our paths have kind of crossed a couple times, but
Yes.
you were probably the first on the planet that said, I love shockwave because you bought the domain. So as soon as we met, I was like, dude, we're on the same mission.
I know. See, and that's why I ask, everybody's like, when was the time that you fell in love with shockwave? Because it's like, once you taste it, there's no going back. Once you use it one time, that's it. You will fall in love. You will have that marriage for the rest of your life, or as long as you're in practice, and even after. I cannot think personally, if I have a case and I use it as pretty much as a monotherapy now. It's like only all I do it's shockwave, and then we don't do any exercise, anything. We just send people away and just say, it's like, hey, go to a clinic that specializes in the exercise and like help and support with it. But we are just shockwave. We are in so much love with shockwave that there's nothing else.
We're just kind of scratching the tip of the iceberg with this technology. And like you and our other doctors, we're on a mission to end pain and suffering for millions of people without opioids, narcotics, cortisone injections, or joint replacements. I mean, I'm in the States, so I don't know if you hear it, but we lose 1,000 people per week to opioid or prescription drug overdoses. 1,000. Like, we're just getting on the end of this pandemic, but we can't forget that United States is still in an epidemic. And that's like having 2 jetliners crash every week. That would make world news. But for some reason, we kind of sweep it under the carpet here and like, oh yeah, it's just the risk of, you're going to see your doctor. You may accidentally overdose today, So, I'm only on this planet for a short period of time. And, I want to make an eternal impact. And the doctors that we've now trained, and I guess, I'm not the founder. I didn't invent this, but I am the developer of the protocol that's used in close to 600 clinics now. And it's the less is more principle. Because obviously, this was genuine lithotripsy, right? This has been around for 40 years. But recently it's a 3rd generation, and, it's 1/10 of the strength. So instead of doing 20,000 shockwaves, our people were using 2,000 shockwaves. And I came from John Warlick's school of thought, where if any shockwaves that weren't causing pain and discomfort, they were wasted. So what I realized working with all these diabetic and neuropathy patients is that less is more. You couldn't overstimulate their body or they'd crash.
Exactly.
And this is a powerful, intelligent energy, and specifically our device. And I love all shockwaves, but they're not all created equally. But ours is like taking a lightning bolt and thunder and putting it into a handheld applicator that you can point at the human body and decrease inflammation, decrease pain, but also cause a positive systemic effect. And really help stimulate the body's natural healing ability. And I think that's the message. I mean, our doctors love the results they're getting with their patients, but also it's making their clinics financially stable. And the business side of this is really why I've invited you to our next Shockwave Business Academy, and I'll have you on as a guest very shortly on that. So
I would love that. So it's and you use electrohydraulic system. So Softwave, it's electrohydraulic system, which is pretty much the gold standard of shockwave generator.
We're in Harvard, we're in Mayo Clinic, Cleveland Clinic, Baylor University, University of California, San Diego. I could go on and on, right? I mean, Children's Scottish Rite in Ohio. They are using it for children with cleft palate. I think this is one of the most amazing stories, because these children are born with a congenital deformity, and these wonderful doctors at Scottish Rite in Ohio are performing this cleft palate surgery, and then they're utilizing our Softwave on the scar and the hard palate.
Yes.
helps heal the bone, helps
Yes.
decrease scar tissue. Shout out to Dr. John Mullins, who's one of my partners at, as a medical director here at Shockwave, but he is the one who helped train them. And the cool thing is these doctors at Scottish Rite, they used to check the children every 3, 6, 9 months because they're flying in from all over the country. They check them in 9 months now. That's how it helps accelerate the body's healing ability.
Yeah, honestly, speaking of that, I treated a young guy, 10 years old. And then just yesterday, I had a gentleman who's 70 years old and treated him even at this time. So it doesn't matter when it's treated, the results are mind-blowing. Mind-blowing.
You know what I want to ask you is, I believe, again, I love the electrohydraulic, but do you, I personally have this opinion that it's melting away scar tissue.
Exactly. Yes. So physically, from the mechanotransaction principle, it actually breaks down the scar tissue's adhesion, so it relaxes the scar. And then once the regeneration kicks in, the stem cells and angiogenesis and all that, that's when you see it like 6 weeks later, 2 months later, it's just like, whoa, there's a new skin. There's like, white skin inside the scar.
Yeah,
healing out the scar.
I love that you use the term mechanotransduction. Yes. And for some of our listeners who don't know it, it's really compression of the cell membrane and then expansion by 10%. And that high pressure, low pressure creates a shearing force that actually knocks oxidative agents off the cell membrane, improves cell membrane permeability, but also we have class 2 clearance for activation of connective tissue. What is connective tissue? It's the building matrix of all biological life. So it's, nerve, skin, bone, even adipose tissue. And I like to remind our listeners that like Shockwave has 48 different patents in North America.
Wow.
And one is specifically for nerve regeneration or peripheral nerve elongation. And some of the cool studies, as you know, they're using our technology in 13 trauma centers in Austria. And they have a national health mandate that any spinal cord injury patients are treated in Austria within 72 hours with our technology. To help decrease inflammation, decrease pain, stop any hematoma developing, around the injured area. And that's where we're seeing the greatest impact, because up until this point, there's no potent therapy for spinal cord injury patients.
Exactly.
Shepherd Spine Center here in Atlanta is one of the top 10 rehab centers in the country when it comes to spinal cord injuries. They have one of our devices, and Dr. Mullins has been training them as well, but also they refer patients to our clinic at ATL Pain Institute for post-treatment, which is awesome because we're working with some unbelievable human beings that have a will to live.
Honestly, I use electrohydraulic system, and then I use the electromagnetic, and then I use the radial pressure wave. So it's interesting. Electrohydraulic systems for neurological conditions, scars, activation of muscles. If I have a muscle that has atrophy or hypotonicity, I go and use electrohydraulic system. And it's unbelievable, the response. I think we have it somewhere. I had a client, it's on our social media as a testimonial. They recommended this lady to have knee replacement because she could not even stand up from sitting. And I assessed her. It's like, okay, this is just muscle weakness. There's nothing else, nothing wrong with the joint. I do one session. She goes from not being able to stand up to like literally jumping. And it's unbelievable. I don't think so you get that response with anything else, no other tool. Yes. Yeah, I think you're muted.
What? My dog's barking. I apologize.
It's okay. Don't worry about that. He's excited.
And that's the thing. This is what I'm trying to teach my doctors. I mean, anybody can be a thought leader, right? Anybody can come up with a thought leader, but to be a result leader and to be someone who's driving your community as the leader in healthcare, this is the things you have to do in social media today. I would come home, I've had this for 5.5 years, this technology. And I would come home from my clinic and I'd say to my wife, Sherry, I'd say, Sherry, you're not going to believe this. This patient came in a wheelchair and we worked on him and they walked out. They pushed their husband out in a wheelchair. And she said, did you videotape it? And I said, no. She goes, well, nobody's going to believe you. Right. So I started, I would put down the probe and then I would pick up my phone and I would start capturing whatever came out of their mouths. Some was good. Most 90%, 65 to 90% of the time, it was like, wow, whoa.
Yes.
I mean, we see near immediate relief.
Exactly.
And the way people are healing, it's supernatural in nature. And again, when you combine the body's ability to heal and regenerate, and then you have something that can activate that innate immune system, as well as toll-like receptor 3 and 4 that help modulate inflammation. Listen, this is the silver bullet when you're working with healthcare and chronic pain.
Exactly.
So I challenge all Shockwave doctors out there. Like, hey, show me your best testimonials. Take a picture of the device too, or whatever. But let's start letting the world know about extracorporeal shockwave therapy and what an impact it can have on both healthcare and your function and quality of life. So. We're going to be launching, and maybe you can share it with your listeners and providers, but we're going to start a patient testimonial challenge, and it's going to be big bucks. So we'll be like, it'll be like a 6-week period where you can enter this testimonial and make, we don't have the prizes all worked out, but it's going to be about $10,000 in prizes.
Wow.
And $5,000 for first place. 3,000 for second place, and then a set of steak knives for third.
It's the only way to actually tell healthcare practitioners and patients what it is, because the challenge with Shockwave is that it's too good to be true. But it is true, so it's like I admire you and I congratulate you that you're doing this, because it's going to help the whole Shockwave community to understand that this is a tool that it's must have for any healthcare practitioner that wants to help people non-invasively, and I say gets paid based on results, because in the end of the day we are all in business, right? And when you're in private practice, like chiropractor, physios, and doctors, depends where you are in the world, in private practice you get paid based on the results. If you don't help somebody, they're not going to promote you, they're not going to tell their friends, you're not going to have new clients. And I've seen that, like personally, I've done over 30,000 Shockwave treatments so far, and it's purely based on word of mouth. It's just like I see one person, the whole family, the whole neighborhood, the whole town, if they come from small towns and stuff. So thank you for doing that. And
the first domino is really like boom, right? And then it starts with one. That's what we tell our docs. And you're right. I mean, we just placed this at UCLA Trauma Center, and looking at these trauma surgeons, and they have private practices as well as they handle one of the largest ER and trauma centers in Southern California, but they go through, it's like 4 or 5 stages of enlightenment, I call it, or awakening. The first one is like, BS, this is too good to be true, right? And your body has these, it's called the Semmelweis effect. It's like, it's too good to be true, and then our CEO, John Warlick, goes out there and says, give me 7 to 10 of your failed surgeries. Boom, boom, boom. Every 15 minutes, he sees another one. And at the end, he went 10 for 10. These patients got off the table and were like, wow. So then seeing's believing. But then they get it in their clinic, and after a month, they're like, they go through this other thing as like, I don't know if I want to tell anybody about this. This is competitive, right? So some people will hoard the technology. And and when I fell upon it, I was having people drive from 4 different states around 2 hours. And I would say, go back and tell your doctor, bring them this pamphlet and tell them you
Yeah.
don't have to drive 3 hours to come to get a
Exactly.
treatment.
Exactly.
And then they would
Yes.
buy one, right?
Yes.
That's how it starts. And then it's just like, how do we get this to the masses and how do we
Yes.
make it more affordable? And the reason why we're seeing this in socialized healthcare systems is because they're looking for what's efficient and effective, right?
Yes.
In the United States, medicine has become an industry.
Yeah.
And that's where we have to look at, like Austria, and hold them up on a silver platter, because they may have one of the best healthcare systems in the world.
Exactly. Yes. Yes. Yeah.
And we have to look at what's working around the rest of the planet, because we have to share it.
Yes. Yeah. Okay, Matt. So one thing, because here's the thing: you're sharing your amazing, excellent personal experience with Shockwave. I have the same here, but there's a confusion in the market for the patients and practitioners with radial pressure waves, because they're way, cheaper version, and they're more a tissue treatment. It's more superficial effect. So my goal personally, like even with my trainings, I've divided, shockwave training and then radial pressure wave training. Even though at ISMST, for whatever reason, I don't really understand them, why they don't, internationally separate those two things and make it clear that one is the true shockwave, electrohydraulic, electromagnetic, and piezoelectric system, and then you have, the pneumatic system or electromagnetic for the radial pressure waves. So my biggest challenge has been, even with like in our city, like we have people traveling, from United States, all over provinces for treatments and stuff. And now my challenge is that I don't want, as you said, somebody to travel. I want to send them to where they live. But the market has been flooded with radial pressure wave, which is still good. It's still a really good tool. But we need somehow, to tell the practitioners that you if you want to really invest in true shockwave, this is the true shockwave, and then you can combine them. If you combine them, it works even better, right?
You're preaching to the choir, and I look at you. It's like I'm looking into a mirror. You're just a little better version, a younger version of me.
A little bit younger.
But 3 years, listen. 3 years ago, I realized that was the difference. My first 11 months talking to doctors, I had 110 doctors say no to me.
Yes.
And they'd say, DiDuro, if this is as good as you say it is, why isn't it everywhere? And I'm like, that's what I'm trying to do. I want to educate. But I realized that was the number one question. And if you couldn't explain the difference between radial, electromagnetic, electrohydraulic, piezo, then you were lost. Like these guys were outselling us 5 to 1. And I just, in life, you have to understand that cheaper is not always better. And in fact, in healthcare, you get what you pay for. And I used to have a professor in chiropractic college used to say, you never want to go cheap on parachutes or healthcare. Right?
Yes.
Or medical devices. I threw medical devices in because you get what you pay for. And there's no way on the planet that you're going to buy a $15,000 device that is radial, all right, that pounds on tissue, that can go the depth of maybe 5 dimes into your body with this type of circumference. And it's going to create a superficial. Electrohydraulically, which I understand the best, we actually are the only device company on the planet that has 2 supersonic waves. We have a primary, and then we have a secondary. And I can send you a video that Wolfgang Schaden and John Warlick explain this down to the T. It's beautiful. It's on my TikTok as well. Go to Dr. Matt DiDuro and follow me on TikTok. But that was the biggest thing. And I said 3 years ago, I created a podcast called Free My Pain Now. And on that was specifically set up to educate the world about the difference between these. So one is superficial, and then one is working on a cellular level. Like Shockwave can penetrate the depth of a soup can into your body, creates no damage, damage to tissue, like the mechanotransduction. The radial device is ballistic in nature. It's a little hammer with a metal stylus, and it creates trauma. And then cytotoxicity, which is death of a cell before you get angiogenesis. So they're not the same. And in fact, I only keep a radial device around to show the difference to my doctors and patients.
Yes.
Can't use it anymore. You can't use it.
Yeah.
So you're right, man. That's our biggest job, is not just, we can't stop. First, we have to educate the doctors. Doctor means teacher. You have to become a great communicator. That's what I'm pushing my 600 doctors to be better communicators and really educate the community about these benefits, and that they don't have to take drugs, pills, cortisone shots. Did you hear in Prague how many times they were like, cortisone is barbaric? I heard it too.
I know, but it's still used in North America a lot.
It's like the go-to. It's still the standard of care. And we could be sitting up on the rooftop and yelling this, but you know, you have to, I created a little algorithm for my doctors, and it's basically, you start with the least invasive, less expensive, and you exhaust all those before you even think about putting an oral drug or injecting a steroid or, you know, biological fluids, whatever. That's the algorithm of healthcare to make impact and change. You don't start with most expensive, most invasive. You know, you work through it like a logical
Exactly. And honestly, for the benefits that Shockwave provides, there's no money, there's no value that you can put in there. It's because I don't know personally anything else in medicine that can reach that deep, can cause biological stimulation, release the tissue, and not hurting anything else.
No. I mean, we are now becoming, in the hands of the chiropractors and physical therapists, we are now becoming non-invasive orthopedic healthcare providers with a focus on true cellular regenerative medicine. Remember that. Yes. This, because when we have, our device actually has 24 papers that show we activate your body's own stem cells within 45 minutes. Stem cells are the repairman of the body. Like that's what you need to heal an injury. So when you combine all these effects, and there's 5, we see all the effects. And again, I love Shockwave. I have 7 of them in my clinic. You know, I've placed this out close to 400, personally 400 clinics myself. So, you know, I've tried them all. I love some of the devices you've used. You can have access to those in the United States. And I'm hoping we can create a better partnership in the future
That's awesome. So what would you say to, and I know we cover this, but if there's one practitioner out there in a fence of or heard about Shockwave, like what would you say to them, like about Shockwave? Like
don't cheap out, right? I mean, most people have, like, they want to dig down and find the facts, and you know, they'll go to a certain level. I was a little OCD about it. I had to kind of dig down for the last 5.5 years. This has been the focal point of my life, is like finding the difference. What's the best technology out there? What can I promote to my doctors? We have 1,300 members in Shockwave University, which I think I sent you an invite, but I'd love you to be a part of it. But, you know, every other Tuesday we do a talk, and we're trying to really create best practice protocols. You know, so that we can get predictable patient outcomes anywhere on the planet with this. So I'm like, listen, there's that talked about the Semmelweis effect. It's like, you know, sometimes you over analysis to the point of paralysis. And it's too good to be true. I just wrote a blog about the Semmelweis effect, and literally, if we have to look back at this Hungarian physician, Dr. Ignazio Semmelweis, and in 1856, he presented in Vienna and was to all these other doctors, and he said, listen, I think if we wash our hands after we're in the morgue and before we go deliver a baby, that it will be more beneficial to the mom. And they had this 180-degree, women were dying from delivering because we didn't know the germ theory. So do you know what happens at that symposium is that he is literally ridiculed and yelled and thrown off the stage. They're like, how dare you say that we are dirty? We are healthcare providers. We're the highest educated people in the society at the time. And guess what happened to Semmelweis? He
Wow.
ended up dying in an insane asylum because what
Wow.
happens is first people mock you,
Yes.
right? Then they, accept it, and then they claim it as their own.
Yes,
If you look at modern
yes,
medicine is really that process of what happened to him.
Yeah.
But now we have to look back and give, he was one of the first to really recognize that cleanliness was important
Yes.
in a surgical or open wound setting.
Yeah, but I wanna share, which is like the same meaning, but more from a business perspective, that it's gonna make sense with a lot of practice owners. I learned this, I heard this recently. They said, what's the difference between a wealthy genius and a poor genius? And the difference is that a poor genius, it's about 5 years ahead of their time, and a wealthy one, it's 6 months ahead of their time.
Well, I tell John Warlick all the time. I mean, John Warlick is the founder and one of the inventors of this, and I was like, your children will be wealthy. I told him.
It's interesting because, and I'm very excited and happy, and I thank you and all other healthcare practitioners that are spreading the word of Shockwave in United States, because when I started using that in Canada 2011, nobody knew what I was talking about. And then I see it on LinkedIn and, in orthopedic surgeon, in ortho regenerative medicine or orthobiology, like everybody's getting excited about Shockwave. But then I see it's like they're talking Shockwave, but they're using radial pressure wave. It's like, oh man, it's okay. So now my personal goal is like, I need to educate you on the difference and how to use it properly, because that has been another downside, that a lot of practitioners, they just go and buy the device. There's no support from the distributor on how to use it and educate them. And then they end up using Shockwaves, doesn't matter the device, in their own, whatever they think, like in guessing mode. So I actually used to sell Shockwave devices before, and then I realized that there's enough people selling the devices, but there's not many people educating them. So that's why where I shift I Love Shockwave to purely in education. And my personal goal now is to bring, everybody together. For example, you with your own experience from Softwave, I have my experience, in different technologies, and we become, these practitioners that help others, teachers.
Yeah, this family.
So,
We've become a family of people that really will help make an eternal impact on health.
Exactly. And this is the thing, it's like everybody wins. It's the patient, the client, from a business perspective. So tell me, at your clinic, like, how much do you guys charge per treatment? How does it look like a session? Like, how do you guys?
And by the way, thank you, Uran, for being a pioneer in this field and being here 10, 11, 12 years before so many other people, and keeping the fight going, right? Because
I know.
without people like you and John Warlick and Nicholas Hoppenfeld and these people kept this dream alive because they knew it was going to help all humans in a way.
One day it's going to shine. So
So I mean, I think that we make it very affordable. And the beautiful thing is that you just need a handful of sessions to get, really optimize the body's, kickstart that body's regenerative healing cascade. And, our treatments for, 6 weeks, 8 weeks, we have different plans, but, they can be under $1,000 US. And in fact, the thing that I think is, the proof is in the pudding. When these patients, we've created a $49 and $79 introductory offer because like you, people didn't know what this was. So I know within 5 minutes if that patient qualifies for this type of extracorporeal shockwave therapy. Why? Because when I map out that chief complaint, if I can't find a hot spot or a trigger point, they're not candidates. The more pain and discomfort they have with our technology, the better clinical outcomes. And that's it. So if I scan an area and I can't find it, I'm like, sorry, I don't think it, I had a guy that had his coccyx removed and he's been in pain for 10 years. I did one treatment on him. I did a lot of soft waves. He got no results, no difference. And I'm like, yeah, I would not even gonna offer you a care plan. You know,
Yes.
this technology, I'm very grateful that it's out there, and I've been able to bring this to my clinic and my community. But I do feel like we have a long way to go, and
Yes, true.
we're not accepted. And to be honest, the average internal general practice, family practice medicine doctor will not know about this for another 7 to 10 years.
Yes,
Understand that.
yes.
You know,
Yeah.
Dr. Tom Liu out of University of California, San Francisco, he's world-renowned urologist, and his team is pumping out the papers on stem cell activation. And 3 years ago, he said, especially to urologists, he goes, every urologist is going to need this technology, or their clinics will be antiquated.
Yes.
And I took it a step farther. I say every chiropractor is going to need this in the next 3 to 5 years, or their clinic will be antiquated like a flip phone from 2008. Remember those?
Yes,
they were
yes.
cool,
I know.
but they were not smartphones. And so you're going to have the haves and the have-nots.
Yes.
And our goal is to educate these doctors on which way to go and which investment to make. The beautiful thing about it is my doctors are able to pay off our device within 70 to 110 days, which is internal marketing.
I know.
So
I know that. It's like, and this is what I tell even for example, for the trainings, because first you get the device and we have the trainings, and some practitioners hesitate on the price of the training. But you get this tool, you need to actually know how to use it properly. And what you guys are doing, that's amazing, like supporting everybody on your specific tool, how to use it. But I wish they would understand and see that the price of investment on the Shockwave system, it's nothing. Honestly, at our clinic, at Unpainted Clinic, we like yearly we generate over $1 million just from the Shockwave treatments, and this been year and after year. So the devices get paid off very quick. People are happy, so it's almost like Joe Paul is from Genius Network. He says ELF, like easy, lucrative, and fun. So that's how your practice turns into. Like I look at the room, I literally have a table and I have the Shockwave tools. I don't need anything else.
Because you're absolutely right. The ELF principle. And by the way, Joe Polish has been, I never met him. I've texted with him on the phone, but
really,
he's been a mentor to me and a good friend, David Berg, for over a decade. And
really,
and next year, I hope to be part of that Genius Network.
I'll see. I used to be there, like before COVID. I was part of Genius Network and strategy coaching, and with Dan Sullivan. And I love entrepreneurship. I love, being a good cause in the world, and then within that we all have our unique abilities, our tools, and how we help each other. So
it's like we cloned each other. You're you're Canada, I'm US. I love it. All right, well, listen, thank you. I'm sorry I was running a little behind.
It's all good.
Appreciate what you do, and then I would love to extend that invite to you to come to talk to our Shockwave Business Academy. Okay? Yes,
we will do that with great pleasure and from the heart. So thank you again for accepting the invitation and being here and sharing truly the truth with all healthcare practitioners. We hope that this turns into domino effect to help people save lives and improve lives. So my last question for you: how people can get connected with you or get in touch, like practitioners or patients or.
Yeah, I want to finish. I mean, listen, I have this motto: I'm a student of life for the rest of my life.
Yes.
Okay. And it really comes down to always be learning, ABL. And my dad, my grandpa came as an immigrant from Italy in 1917 here in the United States. And, he worked hard, right? He was a painter. We still have a painting business for 100 years. And then my dad didn't get a chance to go to college. He was in World War II, but he gave myself and my two brothers an opportunity. And he had the saying, he's like, the more you learn, the more you earn, the less you work, physically.
Yes.
And that's really what I want to create, this specialized niche knowledge that our doctors around the world can utilize, almost like an elite special force healthcare group, right?
Yeah.
So the best way to get in touch with me is, I'm on Facebook. It's Matthew DiDuro, but my cell phone, and I give it out, it's 404-402-1903. Texting is the best way. Text me and say, hey, I heard, I want to learn more. I want to help you and Uran on this mission, and we'll rock and roll.
Awesome. Thank you again for your time. We'll put all those details on the show notes, so whoever needs your help, then they will contact you.
Dr. DiDuro@gmail.com. Thanks again.
Awesome.